So let me turn this around. Namaste, man. Hello. Hello, Bahatin. Thank you for coming in. Hi, Christina. RF1, welcome, welcome. Let me turn this around so we can make sure you see Dr. George. It has Dr. George Kosmides. Let me see if we can get you to see this perfectly here. And everything looks like it's good to go. Can you guys see Dr. George here? Hello, Christine. How are you? So, for those coming in, my name is Lynnie Wennerstrom, creator of CrazyAwesomeHealthyYou.com and author of the book 7 Simple Steps to a Crazy Awesome Healthy You. This is the Beyond Awesome Show. It is about pursuit of health, happiness, and inspiration. Basically, it's for you to get healthy, to feel amazing, and be the best you can possibly be. And so I am so delighted to have Dr. George join me today because he's amazing at that. He's a functional medicine. And doctors are amazing because they care about the entire body and they don't go drugs first. It's really a holistic approach. So let me introduce him. Good, thank you. You're welcome. It's perfect for you. I'm so glad, Christina. You guys feel free to ask questions, but when he gets into something, listen for a minute and then post your questions, and we'll go after it. So George was rear-ended. He nearly lost his life as a teenager in a car accident, and after months of medical care with one of the top orthopedic surgeons in the country, Dr. George was scheduled for spinal disc fusion surgery in his neck and low back. The pain was so bad and George was so weak that just getting in and out of bed or even going to the bathroom was difficult. If any of you have ever experienced anything like this is. So after months of care and seeing the orthopedist and physical therapist, George at only 19 years old was worse, not better. He was holding off on back surgery, but at the same time was willing to try anything. Hey Tommy, welcome. He was not only on pain medication, but now he was taking Zoloft and Xanax medications as depression was happening. Finally, George, becoming open to options, prompted by his father, sought out other healthcare professionals, keeping the surgery as a last resort. Good afternoon, Tommy. George arrived at the New York doctor's office a mere 130 pounds, unable to control his bowel and bladder function, and wearing adult diapers, sleeping an average of 12 to 16 hours each day, with extreme acne on his face, back, and was very weak physically. He was on severe medications for pain and depression, and his blood test started to show liver and kidney damage, as well as several other blood test factors that were in abnormal ranges. So let's just go to, in 1996, Dr. George lost his father at the age of 56 due to complications from cardiovascular disease, and his two uncles a few years earlier, who were 31 and 55. They all had type 2 diabetes, as well as other conditions of poor health. Dr. George then began to look into why they died so young, and all were under the best medical care. So he thought. So that is a good place. Get into Dr. George and get right into. Let's get into what is first of all. What is functional medicine? Dr. George, tell us what functional medicine is and why you went, because you are a doctor of chiropractic. Explain your process of how you got into chiropractic and then how you got into chiropractic medicine, I should say, and then into functional medicine.
Well, the accident prompted me to change my career back in the early 90s. And when I went to become a chiropractor, that's all that I thought I wanted to be, was just adjust people's spines or adjust their knees or elbows, get them out of pain. But then my father died 4 years in the practice, and I was quite shocked by that. And I began to run across authors and doctors like Dr. Karen O'Day, Dr. Perlmutter, a neurologist, and reading their works, found out that this process could have been totally reversed. So I began to dig into it more and more, and while I was doing this, I was practicing in Phoenix, Arizona, and there was a medical doctor above me, Dr. Shelton. He found out what I was doing and started sending me diabetic and chronic illness patients. And I would run back to the treatment room, run back to my notes, run back to the treatment room, run back to my notes, because I was just getting into this, but we were starting getting some big success. So that was in about 1997. And then I took a trip to China thereafter and learned acupuncture, and actually went to the Chopra Center when it first opened in La Jolla, and studied Ayurveda. So I guess I was a functional medicine doctor before that term was even realized back in the late 1990s, it was just someone who would do the best he could and have as many tools as he possibly could have. Because when patients would come to you and say, I'm taking acupuncture, or I'm under Ayurvedic care, I think before you comment, you have a reasonable idea of what they're doing, even though you may not be certified, and then be able to give them some guidance.
So what does functional medicine mean? I mean, if somebody says I would like to go, what does functional medicine mean? Like what makes you different than, say, a Western medical doctor? What's the difference between the two practices?
Good question. I think the big difference is symptomatology. So when we have the symptoms, when our stomach bothers us or we have heart palpitations, I'm going to look at it as that's a sign that something is going on. Maybe the adrenals are exhausted. Maybe the person's under severe emotional stress. Maybe there's other nutritional things going on. Maybe there's acupuncture situation going on. So I'm going to look at the symptom more as a sign versus traditional allopathic care. We'll say, okay, what can you take to shut down that symptom?
Allopathic meaning Western medicine.
Meaning traditional Western medicine. It's slowly changing traditional. Basically, traditional medicine will work on how do I shut down that symptom versus, as you call it, a functional medicine doctor. I guess that's accurate. Versus FMD. What's causing that symptom, and what can we do to resolve it? Is it dietary? Is it emotional? Is it a combination of the two? Is there something else involved?
So if somebody walked into your office and they needed, and they said, okay, I have bloating and constipation, I don't feel good, I have low energy, and I'm tired all the time, which is pretty common, right? Is that, I mean, where would you start with a person like that?
Usually the first place you want to start is find out what they are, how they're living their lifestyle, what's happening in their life. Did they just lose a parent? Did they just lose a significant other? They just have a divorce? Patients, and I can do these over the phone and in person, patients are actually quite shocked when I ask them these personal questions, because it's real important to get into the emotional part of it. There's not one condition that I can recall that didn't have an emotional basis to it. And in some cases, I would say more than half, it's the foundation of their illness. So their emotional disruption happens first and is ongoing, then their chronic organic condition just gets worse and worse.
And so would that also, emotion and stress are two different things, correct? Or are you tying those together?
They can be separate and distinct, but you're not going to have, let's say, emotional discourse or disagreements with your spouse. And also, it's going to affect every other emotional aspect, spirituality, how you have your daily cycle, all these types of things. So you kind of pick and choose which ones are affecting that particular person. Then before you can even start plugging a course of action, you have a baseline of where this person is at emotionally. Are they self-loathing? Are they mad at themselves or someone else that's eating them up inside? I'm not saying I have answers to that per se, but there are steps that you can do. There's a couple things that I do within the first week that people are pretty amazed of, and it gets pretty big reactions, positive reactions. They're really simple.
Can you describe some of those things that you do? So, because I think it sounds really, really vague. So take somebody just go through a process real quickly.
One of the things that I do with some of my chronic illness patients is I'll have them write a letter to themselves. And what I'll basically give them parameters is, number one, no one's going to read the letter but you. And I want you to write the worst event in your life that happened. Maybe it was death of your father, death of your husband, abuse, could have been in your childhood, it doesn't really matter. And a lot of times patients would say, oh, I really don't have anything like that, or I kind of have an idea. And then you see them a week or two later once they've written the letter, and they've written 15 or 20 pages of things they never would have thought of.
Right.
So those subconscious emotions can be what's causing the self-loathing or they can actually influence hormonal and blood test numbers pretty significantly. So it's more of a self-realization of what's going on, and then you can kind of begin to put together a clinical picture of what's the best way to help that person. Based on that, we're objective testing and so forth.
That to me is so incredible because it really is. It's so much. We're so much more than our symptoms, and we are taught that we have been taught since birth. Almost every one of us is alive today. That it's, unless you're maybe in your 90s, that it's really, if you have a toothache, or if you have low energy, or you have diarrhea, or you're constipated, or you have bloating, or anything, an earache, all it's a symptom. But what is the root cause? So if I came into you and I said, okay, I first of all, I'm going to be really embarrassed, right? Okay, I'm constipated all the time, Dr. George. Can you please help me? And then sometimes I'm bloated, and sometimes I have, and I know you talked about, you're going to ask what we're eating, what I'm eating, but I need help now, okay? And I'm looking to reduce the symptoms. Can you help me?
Okay. Yeah. One of the things that you can do that's bloating, usually there's a fermentation process going on in the gut. So food's not being processed properly, so it's fermenting, much like you ferment beer. And you notice if you have beer, it's carbonated, so you see a lot of gas. It could cause that.
Oh, I love that.
Usually it's a combination of things that you eat on daily that cause fermentation in your gut. Now your gut is extended, and it's going to be quite painful. So one of the first things I recommend is, let's see if we can clean you up reasonably. Maybe it's a simple lemon and water, warm water first thing in the morning, maybe 4 or 5 ounces. Try that for a few days and give me some feedback. Because depending on the severity of the person, you don't want to do too many drastic steps too quickly.
Uh-huh.
If you give someone to do too fast that's in a lot of trouble, you can actually push them over the edge where they, maybe get a hypo or hyperglycemic incident or some other things. Sean. But I like the lemon water because it begins to alkalinize the digestive tract. There's no carbonation. A lot of people that have digestive issues, also some of them major in carbonated water. I don't recommend carbonated water at all. They think it's going to be almost like a rotor-rooter effect, and it doesn't work that way at all.
Interesting.
So
wait.
they're simple.
I'm sorry. Can you just explain carbonated water? I've had so many people ask me about that.
So carbonated water is CO2. It's a gas, right?
Yes.
Well, the best way to understand physical metabolism or our physiology is if we're breathing heavy. The reason we're breathing heavy when we exercise or we run or something isn't because we're lacking oxygen. We're breathing heavy because our body is having a hard time getting rid of the CO2.
Really?
It's not an oxygen problem.
Yeah, very nice.
So here you're going to drink CO2 water that has this gas in it that your body has a difficult time getting rid of on top of your own metabolic processes. It's not beneficial. Do you see my meaning?
Oh, yes, I do, absolutely. Because you're putting CO2 on top of CO2. That you're trying to get rid of CO2, and you're putting more CO2 into your body, carbon dioxide.
Yeah, that's pretty accurate. So when I base my functional medicine approach on someone, I'm looking at those little things and what we can remove gently and reasonably over time. Remember, this is a marathon. It's not a sprint. You're not going to take someone on the first and have them peachy keen by the 30th. You'll see some major improvements. But if they've got a chronic condition that's been there for decades or even several years, you've got to move them away from things gradually in order to get a very substantiated improvement over time. Blood test improvements, lab improvements, and so forth.
What are some of the tests that you can do and for somebody who has low energy, or what are the tests that they would, like your vitamin D levels and your besides that's just a regular panel, but what are some of the tests that you do?
Yeah, they can have their at their primary care, they can have their CBC done, their blood count done, general blood, see if they're anemic. Doesn't always show everything, but you can pick a lot of this up by their lifestyle. So what I do with my virtual patients is I'll give me a 3-day eating list, and they can email it to me in a simple email, or some of them go as far as sending a spreadsheet to me. Send me a simple email, your 3-day eating list, and see where you're at. And then you get an idea based on my background in nutrition and just thousands of patients that I've seen. Oh, if this is their eating pattern, they're probably suffering from this. So I already have some ideas in my head. Then if I review their lab work, then I can begin to put 2 and 2 together and say, now I understand why this is happening. So you have to first come to an understanding of the person before you start throwing different things at them. What's nice about natural type therapy, nutrition and acupuncture, other things, you really can't hurt them, but at the same time, you want to hit home runs quickly.
Right.
Because people usually, what I see, this is they've been referred to me, and this is new to them.
Mm-hmm.
So when you take them through a course, you don't want to have them a week down the line only 5% better, and they say, oh, that functional medicine doesn't work. So now they've gotten a bad experience. But you let them know, hey, you've had this problem for several years. Give me 30 days to really begin to move you forward. You'll get better along the way, but here's the obstacles that you're going to face. So if someone's constant, they may have a week where they have nothing but diarrhea for 2 or 3 days.
Right.
For 2 or 3 days. So again, these symptoms are going to express themselves and they're going to happen. But the key is to manage them so you don't overwhelm the person that's going through this work.
It's when somebody, what is there an average patient that comes to you that seeks you out, and if there is, what are their average symptoms? What is it that the average, not just American but Western patient eating processed foods and things of that nature, today's standard American diet, what are you finding that is I'm not going to say typical because nobody's typical, but what are you finding most in your practice?
The average. Well,
average
since I wrote my third book on diabetes, now I have an online course on it. I've been meeting a lot of type 2 diabetics. There's only about less than 2% of the population that diagnose type 1, so they're pretty rare. But what we have to understand is people that are a type 2 diabetic, they were unhealthy first. There's no such thing as a healthy type 2 diabetic, in my humble opinion. So type 2 diabetics, and I talk about this in my continuing education class to doctors here in California, they spend 2.3 to 3 times the amount on their health care that a non-diabetic spends. So unless we approach their total health care, and we're talking about high blood pressure, cardiovascular issues, obesity in about 70% of the cases, digestive disorders, constipation, lower leg swelling, sores that won't heal. All these things aren't caused by diabetes. They're pre-diabetic health concerns, and diabetes manifested itself down the line. So it could be very, and you pegged it earlier, Lynnie, that the symptoms can be things like constipation, diarrhea, abnormal physiological functions happen first, then disease process happen later.
So fertility, would that be affected?
Everything will be affected. Everything from fertility to a man or woman's sexual libido. If you're not healthy, all these other accoutrements, I call them, just fade away. You're not going to have a healthy body and have poor libido. You're not going to be unhealthy and be physically fit. It doesn't make sense physiologically.
If anybody has...
I'm sorry?
No, I was just talking to the people, the few people who are watching right now. If anybody has any questions, please go ahead. Feel free to ask and comment on this, so you can get your Dr. Rochter. Hi, Dr. Rochter. Welcome. So you can reverse diabetes, correct? You can reverse all of these symptoms. Hi.
Well, diabetes has been being reversed since 1982. Anyone who knows anything about diabetes and diabetes research, Dr. Karen O'Day from the University of Australia wrote some fantastic papers and peer-reviewed research articles that first got me angry and compelled me to get into this work. Now I'm teaching it here in the state of California. So type 2 diabetes, I've had patients in my office with blood sugar over 800. To give you an idea of how high that is, the average is 880, 120, or 130. I've had 817, I've had 811, I have 776. And a couple of the gentlemen that these numbers were in the 700 ranges were 6'4", 150, 160 pounds.
Wow.
So you do not have to be obese to have type 2 diabetes. It's more common than not, but it's not an absolute.
Uh-huh.
So they went through a program, and within 60 days their blood sugar was balanced. But more importantly, their other blood parameters became normal. Their cholesterol ratios, their blood pressure, all these things became normal. And working with their primary doctor, the doctor was able to document this objectively and monitor their medications appropriately. And that's the whole goal here. It's not to be a rogue and pull them away. It's to give them the tools and also to be able to articulate with the doctors that we're going to work together here, not I'm going to quit everything and just do this. It's not the way it works. It's actually pretty dangerous.
I find that fascinating that is a very, very high blood sugar level, and these people were not obese, and I how does what happens to the body when somebody, and we've been talking about symptoms, so maybe all the things we've been talking about, but specifically with a high blood sugar count like that. Oh, let's see, 2013, eating too much fruit. That's a, Dr. Rock, go ahead.
Yeah, that's a misnomer. So on my meal plan, I have fruit 3 times a day. There are certain fruits that have a higher glycemic load. So let's talk about this for a minute, rationally and reasonably. There's 2 aspects that my patients become very good at: understanding what a glycemic index is and understanding what a glycemic load is. They're 2 different things. A glycemic index is based on a number of 100. So they'll categorize a food based on the glycemic index of 100. So let's take a white potato.
Yeah.
Has a very high glycemic index. They're not on my meal plan. They're above 75, close to 80. But the glycemic load is over 50 or 60. So the glycemic load is really high. But now you take a purple potato, their glycemic index is about the same as a potato, but their load is about 12. So a load food is going to spike the blood sugar much less than a high glycemic food that has a high load. So there's particulars, but once you understand the difference, and this is not addressed at all, I think I read a national organization for diabetes says we should be eating 80 grams to 200 grams of carbohydrates per day, but they don't qualify. Is it a simple carbohydrate? Is it a complex? Is it a high load or is it a low load? Where's the index at? And that's where the poor diabetic gets so confused because they're not given accurate information. So based on things like that, diabetes is scheduled to, in the next 5 years, go up 41%. We'll have over 300 million people that are diagnosed as a type 2 diabetic. But if you look at how people are educated, they're not given the key facets on this load issue from my perspective. And in my book and in my work, I make it absolutely crystal clear and simple to understand the differences. We have these tools. When you do take your lab works to your doctor, your daily blood testing, you know exactly why you had an elevation, you know exactly why you had a decline. So there's no more guesswork. And that plays on the emotional part of the person who has the diabetes, because now they're seeing some drop in elevation based on their particular actions. They know exactly what's causing it. It creates a whole different mindset.
Now, Janet,
so
I'm sorry. Janet,
that's the mindset aspect. I'm sorry, go on.
Janet, watching, she said she's had high blood pressure and has been unable to lower her blood pressure for a really long time. How would you approach that for Janet?
Well, interesting. The number 1 cause of high blood pressure is dehydration. So the first thing I would ask Janet is, what's your body weight, and are you consuming half of that body weight, relatively speaking, in water? And the reason why dehydration causes high blood pressure is your blood is about 75 to 80% water, blood plasma. So when you dehydrate the body, the brain needs water, organs need water. Guess where it pulls it from? It pulls it from the blood. So when you dehydrate the blood, you thicken the blood, you make it more viscous. And if the blood is more viscous, it means it's thicker, the heart and arterial walls have to pump harder. So guess what happens to the blood pressure? It naturally goes up. So that's the first thing I would fix first and retest. And then you just go, you escalate your care based on the resolution. I would say 50% of the time, just the hydration issue begins to make the adjustments to the blood pressure.
Can you see comments on your phone?
I can. One lady asked about organic food.
Okay.
That's the last one that I reviewed. When you can get organic, absolutely do it. I read years ago, Dr. Wall wrote a book about that. He wrote, and this is pretty accurate, crucible vegetables, things like broccoli and asparagus that have a very hard, crunchy exterior, resist the absorbing of pesticides more readily than, say, a strawberry or a blueberry or a raspberry. Now, does that mean you should have non-organic? If you can afford it and you can have access to it, definitely organics are the way to go. No question about it. But are they going to play a different role in your blood sugar? I haven't seen any research that says a non-organic food
You're welcome, doctor.
is less of a load than a organic food. I haven't seen any research that compares the two from a glycemic index or load point of view.
What about nutrients? I mean, organic versus conventionally grown.
research is pretty clear that there's a distinct difference, not only in the nutritional value, but they actually look into the DNA in these plants. They find those are much more orderly and much more structured. So there's no question it makes a difference. That's not even anybody that tries to debate that is just they're going to fall on deaf ears because the research is crystal clear.
Except there are lots of people trying to debate that, and so if somebody feels, and I get this question all the time, what's the difference between an apple and an organic? I'm just going to pay more. How would you what research would you?
That's good. That's a really good example. I'm glad you brought that up. Commercial apples, to my knowledge, the last I checked, they're sprayed with a chemical pesticide called Alar. And that's that waxy. If you ever get a commercial apple, you'll see this waxy coating on it. If you wash it, you'll see it almost looks like it's peeling skin, and that's that Alar coating.
Mm-hmm.
It seals in the moisture. Also an insecticide. That's very harsh on the digestive tract. So that's the one fruit I definitely recommend if you're going to get apples, make certain that they're organic because they're absent of this Alar. And again, I'm not for anything. I'm for what the research says and what peer review has to say about things, and that's what I recommend to my patients. As far as my personal beliefs or what I think, my thinking is all based on research, not really because I'm not all-knowing. So when someone asks me something that I don't understand, what's the peer-reviewed research have to say? You begin to dig. So my diabetes program, initially it was controversial, but all my research is based on things like PubMed, Physiology Today, The Lancet, all medical journals.
Uh-huh.
I post 56 peer-reviewed research in my book, and 28 of them are direct references to research articles about reversing type 2 diabetes.
Are you familiar with Stephanie Seneff from MIT? She's a researcher. She's a PhD, and her whole focus is on sulfur and glyphosate, the molecule glyphosate. Mm-hmm. Do you know what glyphosate?
I'm familiar with some of her work.
So glyphosate is chelates right onto things like manganese and other things and pulls them out of the body, but it's also horrible on gut health. Correct?
I believe that's something that is that the insecticide they're spraying on crops now for the
Monsanto.
The aspect of the GMO.
Yeah,
I have a couple slides on that, and it does show a precipitous increase in mortality and the use of that product. So there's no question. As far as GMOs go, the research doesn't look promising with that. I understand what they're trying to do, but it doesn't appear to be working, and the politics behind it seems to be a little bit slanted against the organic farmer. So on debates like this, I'm always going to get the research. I think the problem that people run into is they get emotionally connected to debates versus relying on the science, which keeps you impartial, and that's how you should be. Almost looking at these things like a legal attorney or your counsel, and saying, okay, what's reasonable here? And then when you apply that to people that are on the fence or on the other side, they see your reasonableness, and maybe you can sway them to open up their mind's eye and look at things a little bit less emotional. Because when you start getting into medicine, people have certain beliefs, but if you can get under those beliefs, and say, okay, what's your foundation of the understandings? Are they research based? Or are they hearsay?
Right.
Are they just purely anecdotal?
But okay, so not a but. I'd like to go into then this maybe glyphosate, the molecule. You're not. I mean, I don't know how familiar you are with that research, but I mean that is Monsanto, and it's not just about Monsanto, because this is not just Monsanto, but this is who sprays, like even on conventionally grown wheat and durum and lentils, just to desiccate them at the same time, so we're getting that molecule on and this pesticide.
No, I totally get what you're saying. That's not my field of expertise, but I totally get what you're saying. And if someone said, would you want to have Monsanto-based farming or organic, I would always lean toward organic. But that's really not my field of expertise.
Oh, okay. I'm talking in relation to into gut health, because okay, so that's fine. So then let's.
Well, the answer is there's no question that, at least the research that I've read, that small crops and glycosides affect the gut health. They initiate leaky gut, increase the permeability. There's no question about that.
Right.
But someone who's healthy can tolerate in my humble opinion,
Uh-huh.
inconsistent use of it. But the person that's struggling digestively, that already has leaky gut syndrome, they're going to be hypersensitive to anything processed, anything commercially grown, anything non-organic. There's no question. So if the question that I'm asked is organic-based diet healthier overall? There's no question. I'm in that large group that believes so, and based on the science. So I hope that helps to answer that. I didn't try to be vague at all.
Oh, no. I mean, we're not all experts at everything. So, and, I'm an expert at only common sense health. So I'm always trying to understand more. What is the amino acid that helps helps you recycle not glutamine? What is it that helps you to recycle? Crap. Dr. Hyman talks about it a lot. You want to get more in your body, and so you take sulfur-based. Are you familiar with MSM or just organic sulfur? Is that something that you
Yeah, I know a little bit about methyl sulfur. It's one of the most abundant elements in the body. But rather than trying to customize individual things, I like to keep my information more basic, because remember, the average person that we're dealing with, this is all new to them. So if you've been reading research on a particular topic for years, you talk about it like it's on the tip of your hat. But for a lot of people, this is all absolutely brand new. And to expect them to grasp the significance of methosulfomethane or CLA or any of the particular elements, you're asking a lot. And I did that in my first years in practice. I expected them to know everything that I did the first 2 or 3 visits. It's unacceptable for that.
Yeah.
But I appreciate your going. What we need to focus more on is what's the general daily intake of the person? What's the maximum we can get them to improve consistently? Not for the weekend or not for the week. What's the max information that they can tolerate? And then you fill that out by working with them. I've had people come to my office with 2 or 3 books on diabetes. Excellent material.
Right.
And I said, seeing me versus following the courses in these books. And they said they were just too thick. I was intimidated. That was before I wrote my last book. And I thought about that for a moment. I think they were just intimidated by the size of the book, not the information.
Right. Well, it can be very, very overwhelming. I mean, because I understand where you're coming from, but there's certain things that as people and in our Western culture that we are just lacking in order to make ourselves healthier. So you're talking about very basics. I mean, so I was kind of where I was going was, the sulfur and the magnesium. But let's go back to gut health and just some very basics, because you're absolutely correct. I mean, I was so overwhelmed when I even went into I didn't even know what to do. So I kind of strayed there just because I was trying to get some, like magnesium are very, very basics, and we're so deficient in that. The majority of people are deficient. They're chronically dehydrated. So I was kind of trying to go there. But okay, so let's go back to somebody with the just basics, as you were saying, and kind of wrap it up with what would somebody where would you take it from there then?
Okay, so briefly, let's talk about gut health for a moment. So leaky gut syndrome, I took the work early in the 1990s of Dr. Jeffrey Blank. He was the pioneer, and he was in a class all his own. No one knew this material better than him, and he was considered a fringe. He has, I believe, a PhD in physiology. He was considered on the fringe. Now his work is mainstream.
Right.
So what he determined in his work was that the gut becomes damaged, and elements that go through the digestive tract, normally that are stopped, now pass through. So ever since leaky gut syndrome has been kind of determined, hey, this is a problem, we've seen an increase in joint pains, things like fibromyalgia, chronic fatigue, all these things that are systemic but have no direct apparent causation. But if we go to clean up the gut, and we go back to what I originally said about cleaning up the gut, is where's the person at on their day-to-day eating habits? What can we change reasonably that they can cope with? What's the maximum they can do without being overwhelmed?
You're
It's
welcome,
not that
girlie.
it's the absolute best thing for them. Because there's things that they could be on, they could be taking, they could be doing, but you have to remember the person that has the problem. A professor once said to me, Dr. Premparkash, a brilliant physiologist, said, you can be right or you can help the person that's in front of you. You have to decide what you want to do.
Right.
You can be right with prescribing specific supplements a day they were taking their lives, and maybe they were on 20 or 30 tablets a day. I did it early in practice. I had a lady with massive digestive problems, massive viral infection. I think she was on about 60 or 70 supplements a day.
Yeah.
But I was that way now, 15 years later? No. Did we get results? Yes, but she hung in there. Most people would not have.
Yeah.
You see?
Yeah.
So someone like you may be much more game to follow through than, say, a person that this is all new to them. Their idea of healthcare is taking an Advil when they have a headache or taking milk and magnesium when they have a digestive problem, and that's the extent of their self-care.
Uh-huh.
Now you're asking all these other aspects, enemas, and, it's too much for them. So we have to back up and say, okay, what's the maximum this person can do?
Right.
So review, dietary review, and for anybody viewing this video, I'll do a 3-day dietary review and follow up with a 15-minute consultation, give you some basic recommendations.
Ooh.
Contact Lynnie. I've been doing this for almost a decade now. And again, it's not about stopping anything that you're doing. We have to get a game plan first. It's almost like remodeling your house and having all the remodel rules inside before you even have an idea of what you want to accomplish. So what do you want to accomplish? One lady say, well, I'm 71 and I want to go to the base camp of a mountain. I think what's the biggest ones that they climb?
Uh-huh.
I want to go to the base. Okay, that level of care for someone who's struggling with fibromyalgia and diabetes is going to be much more intense than someone that just wants to save their foot. It all depends on the individual. What are you wanting to move forward with? And you'd be surprised, the person that just wants to save their foot, once they get going, now they're motivated. Hey, this isn't that difficult. What more can I do?
Right. That's a good point. Hold on one second, just for introduce myself again. My name is Lynnie Wennerstrom, and I am interviewing Dr. George Kosmides. Kosmides, can you say your name for me, Dr. George?
Kosmides.
Kosmides. I say it half the time correct. So Dr. Kosmides, and he is a functional medicine doctor of chiropractor. He teaches. He's in the state of California. He teaches so many doctors about he's the diabetes doctor, and he teaches people that. So let's organically clean, vegan, gluten-free, want to eat incessantly. What do you suggest? Did you see her comment?
I did, and I get a lot of comments similar. That's a great comment, by the way. The first question I ask is, do people even know what gluten is? So gluten is the protein source of the grain per se. It's the protein source. What I want people to focus more on, the quality of the gluten that they're eating. So, for example, a spelt gluten is much higher quality than a wheat gluten. So if someone is having an issue with a wheat gluten, it's usually beside the point. They have a digestive issue first, and the gluten puts them over the top. We have to be careful about who's educating us, and usually it's the media that's educating us on
Boy,
this.
that's
so
true.
I actually posted in my LinkedIn, if anyone wants to read it, I actually posted I'm getting pretty good response on it. Gluten is usually besides the point, and here's why. And I explain why gluten is besides the point. And it all boils down to quality. If you have a gluten sensitivity problem, your digestive tract is in trouble prior to that.
Mm-hmm.
Just puts you over the top.
Okay, so what about sprouting grains? I mean, since you're on grains and better grains and not grains, and not to get too deep because I know you want to stay simple, but what about sprouting versus...
Right. Sprouting is better. It removes the germination process that appears to cause the hormone issues and the digestive issues. So I'm not a big fan of any soy products that aren't fermented. So going back to the sprouting issue. But when women, for example, my wife was pregnant, she couldn't have grains for, I think, her second trimester. She would just vomit them out. So the body will usually tell you if you eat grains or you eat something, you get bloating or gassy, maybe right now that's not the best time to be consuming that.
Right. So did you now? Were you thinking that Janet's question about wanting to eat incessantly? I just want to make sure she got that answer. You think that that's a gluten issue? You think that she's eating low quality because she's a vegan, maybe, and not getting.
That's an Is that she just wants to eat all the time? Was that her comment?
Right.
I caught a little bit of it.
Yes, she wants to eat all the time.
Okay, so there's two technical reasons why we eat, and one psychological reason why we eat. So let's break those down. So the first one is caloric. Our body craves calories. I don't see that happening too much in America, but I'm sure there are hungry people here, and most of the time they're craving calories.
Right.
The second one is we crave food for nutritional reasons. The body needs oils or fats or certain vitamins, so it craves foods. The third reason is emotional. And the problem is when we eat emotional, usually we pick the lowest quality foods. So then we get in that vicious cycle. Low quality foods, high calorie foods, low nutritional foods. So our calorie rise goes up, but our nutritional density stays low.
Uh-huh.
So these are the people that are always chasing food, usually. But if we sit them down, usually there's an emotional component and a lack of fundamental information that's driving that.
So that's
that makes them.
Yeah, I think that probably answered. If where diets are concerned, and I know this is not about one diet over another versus paleo, vegan, or anything like that, but can you just touch on, like, what I tell my students and clients is it's whole foods. You know, if it's a whole food, it's not a processed food, and it's something that is good for you, then that's a diet everybody should eat. But when it comes to eating meat or not eating meat, what would you say, or animal products? What would you say to that?
You know, that's a really good question. I've had patients that were full-blown vegans and full-blown meat eaters, and I'm personally not a vegan, but here's my stance on it. Protein is given something called a biological value, a BV, by the federal government. There are several different charts that you can download online.
Uh-huh.
So the highest, and the standard is mother's milk. Mother's has the highest biological value, and then whey, and then eggs, and it goes down. Now, heat plays a role. So eggs are one of the only proteins that benefits from being heated. The only one that benefits from heat. So raw eggs actually remove biotin from the body, and the protein is very difficult to digest.
Interesting.
When it comes to meat,
I didn't know that. I thought it was the other way around.
Yeah. When it comes to meat, it is the other way around. Steak tartare or a raw steak is about 95% bioavailable. A well-done steak is actually carcinogenic, cancer causing.
Right.
So do I advocate eating well-done meats? Absolutely not. Do I advocate eating red meat? Again, we have to pull back and say, okay, I have some patients that I know some days I crave it. It's a physical craving. And I tried to be vegan. I was ovo-lacto vegan for about 6 months.
Uh-huh.
So it depends on the person. I think genes play a role. I think where their physiology and the app plays a role.
Right.
And also what they've been led to believe. Some patients are led to believe I'm just a meat potatoes person.
Yeah.
And the steak is well done in potatoes. Now, does that mean steak and their white potatoes cause their health problem, their diabetes? It certainly contributed. But let's change out that person's white potatoes to purple potatoes. Let's change out that person's well done steak to a medium rare to rare steak with a good side salad. You see how you can begin to massage them without totally taking them out of the picture. Because if you give them too many steps, too many changes too quickly,
right, you lose them.
That material,
yeah,
fall right to the coffee, and they'll never open it.
Yeah, good point. And then, and I have a question from a friend of mine. She is constantly craving dirt. What mineral or what is she lacking? Have you heard that before?
Yeah, I have heard that before. So I think you're right that I think it's a mineral issue. Based on what she's. Usually, people that crave calcium and magnesium will bite their nails. They crave minor trace minerals. They'll eat their own hair. I've seen strange things, but there could be an emotional component to that. But let's rule it out. So she were just asking, what should you do? Have you had any hair analysis or blood tests? That being said, what's nice is you can say, why don't you go down and get you a trace mineral? They have these liquid, I think MyVita makes a good one. A company called MyVita, I believe they're in the Midwest. They have
Yeah.
a mine there that they make in liquid form.
And
Try
concentrates.
taking a tablespoon a day. What's so nice about that approach is you're not telling them to stop doing anything else, but you're adding some trace minerals and see if that has an effect. There's certainly not going to be any negative effects to that.
Right.
But that may not be, hey, this may not be the answer, but something you can try today, and you should know within 24 to 40 hours if it reduces that craving. If it does, we're probably on the right track.
Love it. Love it. So you had is there anything that you would like to add, or if anybody has that's watching this right now, if you have any questions for Dr. George, that would be awesome. We're talking to Dr. George Kosmides, who is a functional medicine chiropractor and a doctor of diabetes. So what you have an offering for people that you just offered, and you also have a course. Do you want to touch on that?
Sure. So anyone watching Lynnie's program today can get in touch with me through my email or through Lynnie. You can email me 2-day eating list. I'll review that eating list, and we'll set up a phone consult. I'll give you at least 15 or 20 minutes, or really however long it takes, to kind of break that down and give you some ideas. And if you want to move forward with that, we can talk about setting up a virtual program of care where I monitor you reasonably over time. We'll talk once a week. You'll get some reasonable information from me. And I keep stressing reasonable. It's not going to be something that's going to be out of the park. I'm not going to take someone who's struggling and make them a raw foodist or a vegan. That's not the idea here. The idea is taking them where they're at and how we can move them in a way that gets their blood work better, gets them happier, gets their doctors happier, and improves the whole family.
Well, that's the whole point of it. I mean, that's the whole point of everything is to move people just a little bit forward, just to feel better and have more energy and feel vital, because that's the entire point of life. I mean, why live life and feel so low energy and not feel good or any of those things? It's like, just, be amazing. Like, you don't have to be amazing, but feel amazing. And you can get there. It's not a, it's baby steps to get there, or you can be an extreme personality like me and just do it, or you can take baby steps, which is the majority of people, and just feel amazing. So I love what you're offering, and I appreciate that. Do you have any last minute, because we're not getting any more comments, do you have any last minute, or not last minute, but just for people who are struggling, we've kind of gone over everything, but just a wrap up of how to, preventative, like diabetes preventative, and maybe some foods to eat. Would you say like bone broth, or what kinds of things can people do to heal their guts, to start eating more healthy, just in a nutshell?
Okay. Yeah, here's some general things that you can begin to do. As a general rule, the darker the vegetable, the healthier. Not always the case. More often than not, it is.
Except with cauliflower, right?
Cauliflower is on the lower end of the nutritional spectrum. There are some colored cauliflowers.
Yeah. Okay.
As a general rule, the more colored the vegetable, the better. I'm getting a lot of feedback on your end.
Yeah, I have no idea. It's kind of getting garbly.
Okay. Do you intake should be close to half the body weight. If you're not even close to that, don't try to get there overnight.
Okay.
And the third thing I'll give, key tip, is your protein intake should be close to half of your body weight.
Wow. That's a day in milligrams. In grams.
In grams.
Yeah.
Grams. That's correct.
Okay. So a 100-pound person should be having 50 grams of protein a day.
Should be about 40 because you have to take into account their body fat is at least 10% or more.
Oh, good
So
point.
that's to get really accurate, you would do a hydrostatic way, get the person's lean body mass,
Right.
and you would feed that body mass 50% of that in protein. And again, a high bioavailable protein. We have to keep in mind, we're talking about protein sources. Vegan proteins are very low biological in value. This isn't me. This is according to the government standards that they base on mother's milk.
What does biological mean?
Biological value means this protein is uptaken within the cell.
Oh, okay.
So they base it off milk. So if you take in 100 grams of the protein in mother's milk, the body will process 99 of those grams.
Interesting.
Whereas once we start eating the vegan proteins, the biological value is much lower. Now, I'm not here to say vegan proteins are bad. I'm just stating the biological value facts. What are we taking the protein for?
Got it.
So if you want nice skin, you want nice hair, if you find you have nail problems or hair problems, usually it's a protein deficiency issue. Not always, but usually.
Right.
So those three things fundamentally, and you should start seeing some general improvements. And again, be consistent. If you have health problems for months or years on end, be consistent. You'll start seeing some improvements within a week or two, but give it 30 days, give it 60 days, give it 90 days, and just keep adjusting it. And find someone that you can work with that understands this information and can give it to you in reasonable bites so they're not overwhelming. I don't believe in boot camps. I don't believe in these aggressive. Really quickly, I had one patient go to a very well-known wellness center. She spent almost, I think, close to $8,000 for 5 days.
Yes, he is, Leanne.
After about a month.
He's been doing this for a long year. You have a comment. Leanne is very impressed by you. Oh, you have. Do you have the photo?
Back to me. We were in the office. We were talking. And I'm saying, what she was starting to have her symptoms come back, and I'm like, "What tools did you leave there with?" And she actually thought I meant gardening tools. What I actually meant was, what lifestyle tools did they leave you with? And she goes, none. So she spent all of this money and time, and now she's pretty much a month later back in the same boat she was before. So unless you teach people fundamentally how to begin to apply these things reasonably, it's not going to work for them, unfortunately. So find someone who's reasonable, has general knowledge, and is willing to reach out to more knowledge if you need it for your particular case, regardless of the type of doctor you're seeing.
Okay, it took me 2 years to find a functional medicine doctor. Where can somebody find somebody like you that understands, whether it be functional, integrative, but somebody who understands nutrition, the body, the holistic approach? Where would somebody start?
Where would somebody start? Well, I do this work virtually. I've been doing it virtually for years.
So they can start with you.
Contact me, and they can start with me, but definitely have a primary care physician, an MD or a DO, that if you're on medications, that they know what you're doing, you have a reasonable plan, and you go there and you speak to them reasonably. You say, look, I'm being proactive with my health. Here's the steps I'm taking. I know I'm on ABC medications. My goal is to get off, or whatever your goals are, and communicate that with them, and you'll learn a lot by their response.
Right.
Their response will dictate if you continue with that person or you find someone else. And that's entirely up to the person that's working with them.
Right.
Because we as doctors, we're here for the patient. The time is gone where doctors, whatever they say now is gospel. Now we can look online. What's leaky gut syndrome? What about this medication? What about this nutrient? And we can kind of research it ourselves. So if I can help you, contact me, contact Lynnie. We can work something out where I review your situation, 3-day eating list, have a consult with you. And if I think I can help you, we can take it the next step. If not, pose questions to your current doctor about what your goals are. If they haven't asked you your goals, bring it up to them. Here are my health goals, whatever they are. Just communicate with them.
Perfect. Love that. So I'm going to go ahead and sign off here. And you're in Redondo Beach, California, but he's
Southern California.
Yeah, Southern California. My name is Lynnie Wennerstrom, and we've just been. This is the Beyond Awesome show, which is all about health, happiness. It's all about your pursuit of health, happiness, and vitality and inspiration. You can catch the replay of this. I will post it on my Twitter feed, and follow Dr. Kosmides. He's amazing. He really is. He gives these amazing scopes that are just so practical, so easy to follow. I love this about him. It's like I just had to chat with him and get him to you guys so that you can see what's going on. So tell your friends about this, the replay. Make sure they listen to it because it's very basic and very fundamental information that will take you to higher highs. No matter where you're starting from, even if you're already healthy, you can be healthier. You can always elevate. So elevate yourself. Be your biggest cheerleader. Be your biggest fan, and continue being awesome. I love you. You're awesome and amazing. And that's it for today. So we will see you tomorrow. We're going to have Dr. Cindy Brown on. We're going to be talking about periscoping the scope. We're going to be talking about Periscope and how addictive it is and what that can do for your personality. So thank you guys. Appreciate it. Have a fantabulous day. Ciao. 5.